I'm Sarah, and the topic that I've been assigned to discuss is the healthcare industry. And I'll be specifically looking at the pharmaceutical industry and the biotechnological industry in this pandemic. So, if we take a look at the healthcare industry in general, we saw that there was a reduction in the utilization of healthcare during the pandemic, and this was specifically amongst those with less severe illnesses. And that was because the people that were infected with COVID were prioritized, and there was a fear that there would not be enough ICU units available for those who needed to be hospitalized for COVID. We also saw that there was a strain put on industries where there was a spike in demand, specifically for PPE and vaccines. And this was because we were under different mandates that were regularly being revised, and different regulations that were put in place meant that the demand would peak at times, and there was a shortage of supply in that area. We also saw that there was a shift from face-to-face to telehealth appointments for those that required primary health care and general visits to their GP. The biotechnology industry saw that there was an increase of a third in their funding compared to previous years for obvious reasons, such as creating a vaccine that's required for this pandemic. And we saw that there was a longitudinal study done by MDPI Healthcare, which analyzed data actually specifically looking at young Australians, and it looked at the pattern of healthcare avoidance. So it saw that there was an increase in the healthcare avoidance during the pandemic compared to previous years, which is expected. As I mentioned before, those that did not have serious illnesses were not able to seek out healthcare as they regularly would, and so we expected this number of avoidance of healthcare utilization to increase. We also saw that there were resource-limited countries, so talking outside of Australia, countries such as Namibia, they had the most devastation in their public health system. And PubMed Central states that through the collection of data in Namibia, overall there was a negative impact on the availability and access of essential pharmaceuticals, especially products such as hygiene, sanitary, and antibacterial products. And the cause of this failure was due mostly to supply chain and transportation issues within the country. So knowing all of this information, we need to adjust how we are going to analyze these industries in the future. So if we look at the healthcare industry, we saw that the pandemic actually catalyzed the transformation for the healthcare industry. And there was an emphasis, or there is currently an emphasis placed on preventative measures rather than treatment measures. And at the moment, I think we've all experienced this. We've seen that there's a greater reliance on technology for remote interactions, whether it's work, school, university, or even telehealth, as I mentioned before. So I think at this stage, our analysis will have to focus on the effectiveness of these new procedures and new implementations of what the world has had to change to. So if we look at some examples of what this means, there's patients that have been shifted to remote care rather than face-to-face care. And there will be more of a focus on remote mental health services. And future models will also be implemented by the usage of AI to model the current weaknesses of the healthcare system and make projections of what the future will look like.